November 28th, 2023 meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Mr. Blankley. Mr. Blankley is present. Mr. Brew. Mr. Brew is present. Ms. Lavecchio Hoffman. Ms. Lavecchio Hoffman is present. Mr. Dondorfer. Mr. Dondorfer is present. Ms. Hasman. Ms. Hasman is present. Chairman Keller.
Here.
Chairman Keller is present. Mr. Morris. Mr. Morris is present. Ms. Smith. Ms. Smith is present. Mr. Udelson. Mr. Udelson is present.
Is there anyone signed up for the public forum?
There is not.
All right, this concludes the public forum. I would now like to introduce Robert Franklin, our outstanding Chief Financial Officer of Monroe County, who is here to present the 2024 proposed Monroe County budget as it pertains to the Human Services Committee. Following this presentation, we'll have a question and answer period.
I'm sorry, Mr. Chairman, this one is a little longer than the presentations last night, so I'll try to keep it moving though. But thank you for coming. You had to. Health and Human Services. I'll just jump right into it. Budgeted spending for all of our Health and Human Service accounts, spending in Health and Human Services accounts for about 54% of Monroe County's budget, a little more than half the county budget, about $794.4 million. If you consider our Health and Human Services agencies as a segment of the budget and look at their appropriations, they're growing by $68.4 million over the 23 adopted budget. It's about 9.4% increase. In the context of the overall spending in Monroe County's budget, particularly the overall growth of $119.9 million, this area's $65.5 million of growth represents about 57% of the overall budget increase. So where can this growth be found? It can be found in the three of the larger agencies that pertain to this committee: Human Services, Public Health, and our community hospital. Growth from 2023's adopted budget, it's about 8.9% for Human Services. The growth is about 12.4% for Public Health and 10.4% growth for the hospital. The Veterans Services Agency isn't really growing per se, but they do have a significant change going on in their budget, and I'll get to them in just a few minutes. Looking specifically at our Department of Human Services, again, overall, you saw this on the previous slide, their appropriations are increasing $50.1 million over the 23 adopted. There's a lot going on in their budget. I'm just going to hit the major highlights, okay? It's the largest changes you'll see is a $19.1 million increase in public assistance benefits. They have a lot of different public assistance benefits. The bulk of this is increase, 13.6 out of the 19.1 million increase, relates to subsidized daycare. DHS also is looking at a $9.9 million increase in a required Medicaid cap payment to New York State, and that's really due to the phase out of the enhanced FMAP sharing. You'll also see an $8.6 million increase in the department's payroll and benefits. They are adding 48.25 FTEs. And we are also offsetting their payroll budget with a 5% vacancy factor for their positions. You'll see in their budget an $8.3 million increase in contractual services, the bulk of which, $7.8 million, predominantly relates to pass-through mental health funding for our community agencies. And the last comment I'll mention about growth, a $2.3 million appropriation increase in debt service related to the Children's Detention Center in Rush. Now, I mentioned the 48.25 FTE increase. Half of them are budgeted for the Children's Detention Center. I also mentioned that $19.1 million increase in public assistance benefits. Specific program changes include that $13.6 million I mentioned for subsidized daycare. New York State has really broadened financial eligibility to expand access. They've also increased the number of paid absence days we pay for up to 80 per year. And they've lowered the parent share to 10%. Previously, counties could choose an 10 to 30% range. They're all at 10% now. And New York State has eliminated the separately funded facilitated enrollment program. Overall program enrollment in subsidized daycare is projected to increase next year, as is the average cost per child. You'll also see a $4 million increase in specifically their TANF public assistance benefits. Most of that is due to the inclusion of a $3 million Project Anchor grant we received from New York State. That's a rent supplement program. The grant comes to us, we contract out with Catholic Charities to actually administer it. The balance of that is really related to family assistance benefits. The average caseload for family assistance is projected to be a little lower than the 23 adopted budget, but the average cost per case is increasing. Within public assistance benefits, you'll notice a $2 million increase in safety net assistance. Like with TANF, the average caseload is projected to be a little lower than the 23 budget, but again, the cost per case is rising. You will see a $3.1 million increase in child welfare. Primarily, that's due to higher costs of adoption subsidies and foster care placements. And you'll see a $2.2 million increase in our purchase of service contracts. Now, higher contracts amounts are budgeted for child preventive, child protective services, and for adult protective services. The only decrease you'll probably notice, the only decrease I'm going to call out, is a $2.6 million decrease in appropriations for adolescent care. There have been a number of statutory changes at the state level. They've really reduced the number of children adjudicated as juvenile delinquents, and we're seeing lower state charges for OCFS facilities. If I can turn to our Department of Public Health, it is a much smaller department than Human Services, but that doesn't really make it any easier to summarize what's changing in their budget. So big picture, public health appropriations are on the rise, $9.2 million, again, compared to the 23 adopted budget. Payroll and benefits actually increased just $889,000. That's only 4.5%. They are adding 3.5 FTEs, but again, like DHS, we're applying a 5% vacancy factor to their budgeted positions. So the main driver of their appropriation increase is a $7.6 million increase in early childhood development public assistance benefits. Most of that increase relates to state payment rates for preschool special ed tuition and itinerant teachers, but also contributing is the higher cost of preschool special ed transportation. Other notable changes that I'll highlight include within our opioid and addiction services division, the impact team is budgeting $124,000 for secondary distribution of naloxone, $60,000 for a new peer training and peer support program, and they're budgeting $80,000 for an advertising and public service announcement campaign. And I'll comment that the Environmental Health Division has proposed $310,000 to continue the lead paint testing services that we pay the city of Rochester. Those were previously grant funded. The state ended that service to us. I will turn to our community hospital. This slide's a little different, and I've done this for a couple years. I keep this particular slide focused on how MCH funds its operating budget rather than where their appropriations are, but I do have a comment on that in a minute. So looking at the revenue, patient revenues, and that's all sources, Medicaid, Medicare, private insurance, represents an estimate based on the average projected daily resident census and our payer mix. For 24, we're proposing an average daily census of 415 beds, which is a slight increase from where we are today, but lower than what we budgeted for the current year, 23. So it's a lower budgeted census, but revenues are higher, as you can see on this slide, and that really reflects a 5% rate increase from New York State. New York State Medicaid probably funds 90% of the patients at MCH anyhow. Unchanged, in our revenues is our estimate of next year's Medicaid upper payment limit revenue. The state is still behind in that program. They just settled state fiscal year 22-23 a month ago. But the state plan for next state fiscal year has already been approved by the federal government, and it's identical to the current state fiscal year. So it should result in another $19.7 million to MCH. So the only real outstanding issue is one of timing. The state usually pays us in 2 6-month periods. Well, the 6-month period, April through September, we usually get a letter from the state late October, early November, but here it is the 28th and nothing in the mail yet. Other revenues at MCH are anticipated to be a little higher next year, and those really relate to our lease of space to outside agencies. The TC3 revenue from FLIPS, and I can't remember the acronym TC3. It also includes insurance recoveries, not health insurance, other, like when a car hits another car or takes on a light pole. They're also anticipating specific grant awards for event planning services, and they also have a couple minor activities that they budget revenue for. So real quick, just looking at the hospital's appropriations, the appropriations budget is increasing by $9.1 million. It's entirely related to payroll and benefits. That payroll and benefits actually increased $9.8 million in the budget. They're only adding 4 FTEs, but we are applying a 9% vacancy factor to their positions. There's a little reason for that. For the current year, 23, MCH had defunded about 29 of their positions, but this year they asked for all their positions to be fully funded. We did that, but given the nationwide nursing shortage, even though we funded all the positions, we blanketly applied a 9% vacancy factor. We try to work real close with them. We all know what goes on with the nursing shortage. Any salary savings they have because of vacancies, they have to call contracted nursing agencies around town. So if they need to pay those contracted agencies, we work with them on their budget to accomplish that. And although the budget for MCH, and particularly patient revenue and all their other revenues, is higher than last year or the current year, it was not enough to fully fund all their additional appropriations. So the bottom line in this slide, you'll see a slight increase to the general fund subsidy. It's now about $13.9 million. So wrapping up this presentation is our Veteran Service Agency. As you can see, there's very little change financially in their appropriations compared to where they were for the adopted 23 budget. There are nonetheless 2 material changes that I'd like to highlight for you. The first change is that the VSA is no longer contracting with Tribe Ecotherapy. That nature-based therapy program is still highly valued, however, so the department is insourcing that particular service. In this budget, you'll see the VSA has added a full-time veterans health clinician, a part-time veterans counselor, and a part-time veterans therapy liaison. The budget also includes appropriations for program supplies and materials. The second change I'll point out has to do with the end of the federal drug court grant. Usually here, when a grant ends, so does the service. In this particular instance, however, the services provided have led to a number of success stories that we've all heard about in prior meetings and agency presentations. So much so that the agency is not only retaining their Veterans Court community liaison that worked under that grant, we're actually adding a part-time Veterans Court manager. So in addition to these therapy and court positions, the Veteran Service Agency has also added another county service officer to its payroll to assist veterans with applying for the federal benefits that they're entitled to receive. So in all, the increase in payroll and benefits is really offset by reduced contractual services and an increase in net county support. VSA's total budget increases about $335,000. Overall adds 1 FTE. Of that $74,000 increase in payroll next year, retention bonuses account for about $16,000 of that. And I think that's it. They're also slated to continue the Veterans Day Parade, so you'll see that funding in there as well. So, Mr. Chairman, it really concludes.
First, I do want to thank Dahlia Wright and her team for the incredible service they brought to the west side of Monroe County this past year. Her team attended multiple community meetings over the past year and brought much needed communication and information around programs that Monroe County has to offer for everybody that lives in Monroe County. I was really happy to see they brought the Family Resource Mobile Unit out where they could sign people up for Medicaid and things like that. So again, just want to send my appreciation. I want to thank her and her team on behalf of our community. So going to some questions. Through the chair, what are the percentages of mandated versus unmandated costs for the Department of Human Services?
Mr. Chairman, while I don't bring that specific detail to these meetings, we can generate that from our system. We'll do that. I happen to know it's like 99.9% mandated.
Thank you. Through the chair, can you provide the legislature with a breakdown of all the positions that fall under this portion of the 2024 budget that are authorized, funded, and vacant? This breakdown should include each title, the corresponding budget amounts for salaries, retirement, social security contribution, medical insurance, and dental insurance.
So, Mr. Chairman, in the back of the budget book, very back section, you will see the personnel listed for each department. We generally have not historically provided our vacancy reports, nor do we really agree that we want to present individual employees' choice of medical plans, dental plans. So we tend not to share their benefit-specific information. I will note, if you look at the positions in the back of the book, you will also see salary schedules. So for a group 56 position, you can gauge where there's relevant salary should be.
Thank you. Through the chair to the administration, you had mentioned during your presentation, could you please explain a little bit more around the lead paint program that you mentioned?
For a long time, Mr. Chairman, one of our departments, whether it's Human Services or Public Health, has worked with the City of Rochester. Their divisions changed names. It used to be Neighborhood. I forget what it's called now. But they ran 2 lead paint testing programs and a certificate of occupancy program that's related. New York State used to fund, more recently, Monroe County Public Health to the tune of about $310,000. Almost all of that was paid to the City of Rochester. I think Public Health kept just very little for administrative reasons. And that funded lead paint testing done by the city staff. That grant went away. It was kind of news to all of us to avoid an abrupt end to lead paint testing. We agreed to fund the City of Rochester for another year at least.
Thank you. Through the chair to the administration, are we doing any type of benchmarking with that program? And the reason why I bring it up is it was stated in our local news that there was a rise of lead in children. And I just wondered if that was from lead paint or possibly from something else that could be contaminated in the home.
I know Public Health has a team that works on this. If we have a rep, I'll invite them out.
Through the chair, can you please repeat your question?
Absolutely. So through the chair to the administration, I was just asking about the lead paint program and what type of benchmarking we do to see if it's making an impact to the children in Monroe County. Recently, there was an article in the paper that showed that there was an increase of lead in children. I'm not sure if that was from lead paint or maybe from something else within the home that has lead in it. And I just didn't know.
Through the chair, there's actually 2 parts to this answer. First off, we do annual reporting with our numbers. So we track all children with their lead levels. At age 1 and 2, kids are mandatory to get lead tested. Doesn't always happen, but then depending on the level, they have to continue going back. So we look at all children, regardless if it's their first time, second time each year. And then we look at all those numbers. And every year we look at the different brackets. So if they were less than 5, which is 5 or above is what we considered an elevated lead level, and different levels above that. So we put out numbers every year. The second part, and yes, that is actually going down. The second part to your question is the Coalition to Prevent Lead Poisoning misinterpreted the results, and all of those news articles have been retracted. So if you go, you actually see that it has gone down about 20%.
Thank you so much for that update. I
You're
appreciate
welcome.
that. Through the chair to the administration, in the Office for Aging 2023 objectives, it's listed identifying an area as a food desert in the city to serve as a meal site for seniors, but that's not listed in the 2023 accomplishments in the proposed budget. Is it again listed as an objective for 2024 on page 167, or were you able to achieve that?
Can you hear me? Through the chair, we opened a city center approximately a year and a half ago, the Prayer House on Cumberland Street. And we are still, monitoring the areas and possibilities that we could open another, at least a meal site, not necessarily a full senior center in the city in 2024.
Thank you. Through the chair to the administration, I also noticed in page 186, there was, let's see here, in the 2023 major accomplishment, it was mentioned about transportation for seniors. Is that for all of Monroe County, specifically for the city? Could you kind of give us an idea?
Yes, through the chair, we initiated a mobility management program and with a consortium led by Lifespan with our ARPA dollars approximately 2 years ago. And that it's in development for a one-click system for folks to access transportation from their homes if they have the digital capability. In addition, there's a Give a Lift program that has 25 grassroots driving volunteer organization and I believe there are a few on the west side, but we know that the west side is underserved, and that continues to be a focal point for our service delivery to increase.
Thank you. I appreciate that. Through the chair on page 177, why were the number of Medicaid applications so much fewer than the estimated amounts in 2022 and 2023?
Mr. Chairman, I have to apologize. I understand because of this afternoon's snow, traffic is really backed up on Mount Hope. So they're all coming from Westfall Road, and apparently they're not here yet.
Okay.
Oh, they're all coming. They're all coming together, Mr. Chairman. So whatever we're not able to answer tonight, we'll follow up.
Okay.
Before Ways and Means Committee.
Thank you. Through the chair again on page 177, why was all the families' work participation rate in 2023 so much higher than in 2022 and the projection in 2024? And could you please give us the definition of agency affirmation rate?
Yep, Mr. Chairman, we can follow up on that. I do know that work requirements were put on pause during COVID pandemic, so that's why the 22 actuals are so much lower. In 23 and 24 projections will be higher. But again, happy to follow up on that prior to Ways and Means.
Thank you. Through the chair to the administration, why are there so fewer fair hearings decided in 2023 than in 2022 and are projected in 2024?
Well, interesting question. I would love to find out that answer myself, actually, but we'll follow up, Mr. Chairman.
Thank you. Through the chair to the administration, throughout almost every division of DHS, why has the retirement line item gone up so much since 2022? For example, the Child and Family Services retirement budget on page 503 has increased by over 1.7 million since 2022.
Well, there's actually a couple things going on there, Mr. Chairman. Specific to the Department of Human Services, their vacancies really skyrocketed over the past couple of years, but they've done a remarkable job themselves and in conjunction with Human Resources to recruit new staff. So and now I'll have to get the numbers for you, but I'm pretty sure their vacancies are, or at least the caseworker vacancies are half of what they used to be. So part of the answer in retirement is we have staff on board now that we have to make a contribution for. And the other part of that reason is, although Monroe County is still in the alternate stabilization contribution program, and we have graduated rates that we know each year, because this year's graduated rate is less than the regular employer contribution rate, we have to make a graded payment. So it's kind of like our required payment plus a little extra.
Through the chair to the administration, on page 179, why do you project an increase in public assistance in SNAP intentional violations?
On that programmatic related question, Mr. Chairman, in the absence of DHS, we'll follow up prior to Ways and Means.
Thank you.
Oh, look at this.
Oh, great.
Good evening. I apologize for my lateness. Janice Reed from the Monroe County Department of Human Services. Through the chair, I will answer go back and just answer the question about fair hearings. Since the start of the pandemic, the Office of Administrative Hearings has held all fair hearing decisions. Most fair hearing actual hearings have been postponed unless there were emergency fair hearings. And so we are hoping that that will be, that will come to an end. That administrative pause at the state level will come to an end, and decisions will be rendered, which is why you see the increase for decisions in 2024. And that same reasoning is for IPVs as well. Intentional program violations also go through the administrative hearing process. And because the state has essentially put a pause on anything that's not an emergency hearing, those are also reduced and may or may not come back in 2024, but we do anticipate seeing an increase in that as well.
Thank you.
Through the chair.
Through the chair to the administration, on page 168, why did the debt services for human services go from about 900,000 to 3.1 million?
Oh, Mr. Chairman, that is entirely related to debt on the new Children's Detention Center in Rush.
Thank you. Through the chair to the administration, why did contractual services go up by 8 million?
Actually, Mr. Chairman, there's a lot of significant things going on there. Within our contractual services, I did mention state pass-through funding for our mental health community agencies. It's about $4.8 million just within mental health in contractual services. There's also an increase of 2.5 million within DHS, $600,000 aging, and then a smaller amount, $400,000 within the Youth Bureau. Youth Bureau is really, New York State is increasing its, I won't say emphasis, but their financial support of youth sports. So we're getting increased allocations.
Thank you. Through the chair, why did the supplies and materials go down by well over 100,000?
Mr. Chairman, really it's because the 23 budget was amended upwards. The department had a cubicle replacement project on the 6th floor over at St. Paul Street.
Through the chair to the administration, daycare increased by 14 million. Is there a new program or is this just the expanded funding?
Mr. Chairman, it's really a combination of the unused dollars received during the pandemic that the state has not swept, but it allowed us to roll forward from year to year, and an additional allocation because New York State has changed its financial eligibility and the service level we have to pay for.
Thank you. Through the chair to the administration, on page 169, could you explain the $19 million increase in the child care block grant?
Mr. Chairman, entirely related to the child care block grant and our increase in subsidized daycare services.
Thank you. Through the chair on page 171, why are interdepartmental chargebacks going up by over 250,000?
I think throughout this budget book, Mr. Chairman, you'll see a number of changes in the interdepartment charges. A significant one is in county IS. Now, I realize most of DHS is on the state network, but they also have components on the county system. You'll also see a higher charge from our county attorney. Our law department has a slight higher chargeback for their family court prosecutions.
Through the chair to the administration, on page 181, there's a $2.2 million debt services solely for the Children's Center expansion. Is this for the Children's Center expansion?
Entirely, Mr. Chairman.
Thank you. Staying on page 181, will the 4 million increase in state aid mostly be going towards this expansion?
Not really, Mr. Chairman. Really, this is state aid for, don't get me wrong, the state is participating in reimbursement for the construction costs. But that's not how the state pays it. So this is really 49% reimbursement on secure detention and 100% reimbursement for specialized secure detention, which is raise the age related.
Through the chair on page 186, why was there no state aid for family assistance in 2023?
Sorry, what page? What?
186.
Yep, Mr. Chairman, that really, we don't normally do this. We decided to put the Project Anchor grant under family assistance. So that $3 million increase in state aid is that grant.
Thank you. Through the chair on page 189, why are the appropriations for adolescent care going down by so much?
A lot of that, Mr. Chairman, has to do with what I mentioned in a presentation about statutory changes. There are a number of those changes. In essence, far and far fewer do you see any youth adjudicated as juvenile delinquents. So we're seeing quite a reduction in our JD and PINS care. PINS essentially went away almost. Lower charges from OCFS facilities. Those are the kids that are actually sentenced and are in state care and custody, but we actually get a chargeback for the youth who prior were Monroe County residents. And a huge decrease in non-secure detention. Really, non-secure detention, it's pretty much gone away. We don't have a lot of options, so we don't have that as a viable resource. So we reduced the budget to $500,000 for those far and few situations when we can make a placement.
Thank you. Through the chair to the administration, on page 197, why are the agency contracts going up by almost 500,000?
Oh, Mr. Chairman, yes. These really are direct service contracts New York State funds us for. And again, there's additional emphasis at the state level on youth sports. So we're getting additional allocations.
Thank you. Through the chair on page 500, why are professional services and central administration going down by almost 600,000?
I think I can answer that without turning the page. A lot of that is related to our Community Integration Initiative and a lower contract with United Way going into 2024.
Thank you. Through the chair to the administration, why is travel increasing by 9,000 and what type of travel is planned?
That is a big jump, Mr. Chairman, but there is a new, I think it's called Integrated Eligibility System that's being deployed by New York State. It's a replacement for the welfare management system. And this increased travel is to allow our management staff to attend statewide meetings about that deployment. It also traditionally includes funding for the two Public Welfare Association conferences in January and July, and NISAC attendance and the State Domestic Violence Conference.
Thank you. Through the chair to the administration on page 502, why do salaries increase by roughly 2 million?
Page 502, Mr. Chairman.
502.
Salaries in Child and Family Services, the budgeted staffing really is not changing. There are contractual obligations for additional pay and step increases that probably would result in actually a bigger increase in salaries. But as I mentioned during our presentation, we did apply after the fact a general 5% vacancy factor.
Thank you. Staying on the same page of 502, why are the software licenses increasing by 15,000?
Probably should be more, Mr. Chairman. This has been an endeavor. We created this account last year as a means to accumulate all our subscription-based software products to comply with a new GASB Statement 97. We have to value our subscription-based software products as if it were a capital lease. So you're seeing a lot of shifting in budgets. Departments traditionally budgeted software as a supply and material. We have an account called computer software. And at least on this page, you'll see that the budget for computer software was $8,250 this year. That's gone away. That's because we moved it up to software licenses. The biggest cost here is LexisNexis, and the department uses that for their family finding.
Thank you. And you actually answered the next question I had, so I appreciate that. Through the chair, we're gonna go to page 504. Why do salaries increase by 1 million?
So again, Mr. Chairman, this probably should be higher. In financial assistance, we have added 10 FTEs to the division. There are a number of upgrades as well. But again, contractually obligated pay and step increases offset by a general 5% vacancy factor held this down to this growth that you see.
Thank you. And through the chair to the administration, I also see there's a $7,000 increase with travel. Is that the same reason you gave before?
It's a little different. The staff are going to those integrated eligibility system meetings, but there are a number of other Albany trainings, and there's a federal program, 4D, that has training the staff goes to.
Thank you. And again, on page 504, why does public assistance benefits drop by 200,000?
This particular item really relates to our allocations and budgets for Code Blue and HEAP. Code Blue that going into next year is about $1.1 million. That's down 200 grand from the 23 budget. And our contracted HEAP, I'm sorry, I said contracted. Our public assistance benefits under HEAP are also budgeted around $1.1 million.
Thank you. On page 506, I see that there's a new line for software licenses for 16,000.
All of it, Mr. Chairman, relates to LexisNexis and how we need to account for that going forward.
Thank you. And there's also an increase to the maintenance and building by 25,000.
Mr. Chairman, there's a number of, and you probably see this in other departments as well. Departments have specific requests perhaps to rearrange offices, shift cubicles, so those are generally outside the DES budget for building maintenance, so each department budgets a little bit of money for those. So these are really just one-off special requests.
Thank you. Through the chair to the administration on page 508, salaries increased by 85,000. Can we have an explanation?
Only one FTE has been added to staff development. So this really is the result of contractually obligated pay and step increases, again, offset by that general 5% vacancy factor.
Thank you. Staying on page 508, can you explain why the professional services increased by 20K?
We do budget. I know staff development has tried to budget more for department-wide trainings than they have in the past. This particular line going into 24 includes budget for crucial conversation and facilitation skills training for staff. It funds $20,000 for an employee resource network.
Thank you. Through the chair to the administration on page 510, we see an increase to salaries, roughly 1.2 million. Can you explain that increase?
I did mention, Mr. Chairman, in my presentation, about half of the additional staff budgeted for 2024 is in the Children's Detention Center. So this budget increase accommodates the additional staff. And again, I'll mention the contractually obligated pay and step increases.
Thank you. Staying on page 510, why does the commercial services increase about 350,000?
This one, Mr. Chairman, a little annoying. This one has traditionally flipped, and if you look at the page, you'll see even a big shift from 22 actuals between commercial services and professional services. The commercial services on this particular line really represent almost all of it is the food service for the youth at our detention center. Small amounts for the commissary there, and then really the balance is their refuse pickup and walk-off floor mats.
Thank you. Staying on page 510, there was an increase for rental space, 40,000.
So, yep, Mr. Chairman, during the period of construction, and with the increase in youth in our care and custody, the Children's Center has had to rent 2 trailers for educational space and recreation space. So those come at a cost. And that cost is represented pretty much in this line. Almost all of it's that line.
Thank you. Going to page 511, through the chair to the administration, why does the principal bonds and interest on bonds increase by roughly 1 million?
That, Mr. Chairman, is entirely for the debt on the new construction of the facility.
Thank you. Through the chair to the administration on page 512, why is the workers' compensation line item so large? Is it because of, I'll just have you answer it.
Workers' compensation, not easy at the detention center, Mr. Chairman, not gonna lie about that. This is really, I'll say this about all the departments' workers' comp. It's really a rolling 3-year average of claims incurred. So there is always a lag, whether it's an increase or decrease, but it's based on actuals, but an average of actuals.
Thank you. And through the chair to the administration, again, staying on page 512, what is the PS security line item? It appears to be a new line item in 2023, and it increased substantially over the last year.
Basically, Mr. Chairman, that is all of department DHS and all the departments. You may recall departments used to separately budget for Securitas, security guards. All that is being run through Department of Public Safety under their master contract. So then they charge back the utilization by specific departments.
Thank you. I yield the floor, Chairman.
Thank you, Legislator Donald.
Thank you. Through the chair to the administration on page 515. Page 515. What are the $3 million in agency contracts for the Family Assistance Division that were not in the 2023 budget?
All that, Mr. Chairman, is related to our contract with Catholic Charities to administer the Project Anchor program. That's our rent supplement program.
Okay, then through the chair, on page 518, why do public assistance benefits decrease by $3 million?
Child welfare, public assistance benefits, Mr. Chairman, are all based on caseloads and cost of case. Child welfare, I did mention increase in foster care placements because judges are fewer and farther adjudicated kids as juvenile delinquent, so we have to find foster care placements.
Okay, thank you. Through the chair, on page 522, what is the $500,000 of postage used for, and why is it $100,000 less than it was last year?
So most of the DHS mail is run through, well, DHS and Department of Public Health share the mailroom, and they accumulate all the costs and then distribute it to the departments. We did lower next year's budget based on where 22 actuals were coming in and 21. I realize COVID may have skewed actual expenses, but does seem to be in line.
Through the chair to the administration on page 524, why do agency contracts increase 600,000?
Entirely related, Mr. Chairman, to state funded. These are mostly our pass-through contracts. So we do see a small increase in our support services, nutrition services, education and training. And we do keep, although we do keep some of the state funding for ourselves, we do have to pass along to our agencies certain admin fees.
Thank you. And same page, why does equipment increase 25,000?
A couple of years ago, Mr. Chairman, the Office for the Aging took over responsibility for kitchen and other food service equipment maintenance and replacement at some of our senior centers. So you'll see going forward expenses for appliance repair like stoves or refrigerators or other cooling systems. This is to account for that.
Thank you.
I think they began procuring that in 22.
Thank you. Through the chair to the administration on page 526, why do commercial services increase to 30,000 when they have basically been zero in 2022 and 2023?
Mixed results here. We used to outsource our event planning, and there's a lot of event planning that goes on between the Office of the Aging and our Youth Bureau. Starting in 23, maybe it was, we started bringing back those event planning. So we've reduced the outsourced contract and provided budgeted amounts for commercial services and supplies within the departments, specifically aging and youth.
Thank you. And through the chair to the administration on page 527, why are agency contracts increased by over $140,000?
All that, Mr. Chairman, is related to our state allocations and our direct service contracts with providers in the community.
Thank you. Through the chair on page 529, is that new salary position full-time or part-time?
I'm sorry, page 529.
529, yep.
A small, Mr. Chairman, a small allocation of the Youth Bureau Director's salary. That's something new they did this year.
Through the chair on page 530, what is the $200,000 increase in professional services for the Mental Health Administration Division? God bless you.
Mr. Chairman, within our Office of Mental Health, there is specific increase for the professional services for initiatives. They are looking to host a conference during Mental Health Awareness Month. And they have to contract with a couple experts in that regard, in addition to a site. They're also looking at a one-day conference, System of Care one-day conference, that they're looking to pay a speaker, keynote speaker to attend and arrange for a venue, and then the food service for all those. And then lastly, I guess I'll comment on, basically for about $187,000, it's a 20% increase in our contracted psychiatric exams.
Thank you. Through the chair on page 530, again, why does travel increase to 50,000 from last year's 4K?
So within travel, Mr. Chairman, the Office of Mental Health is looking to attend a number of new conferences to expand their professional development and send several staff to these conferences. It includes conferences, African American leadership, United Way host a leadership conference on LGBTQ, conference for the New York conference on local mental hygiene.
So they're going to a bunch of conferences. We could. just
Yeah,
leave it at that.
that's a lot of conferences.
Thank you. Through the chair on page 533, why do professional services increase by roughly $1.25 million?
Oh, this one's, Mr. Chairman, it's an increasing number of judge-ordered competency exams for people to stand for trial. So we call them court-ordered cases. But these are mandated by the courts, and that has been an increasing trend.
Thank you. Moving on to revenue questions through the chair to the administration on page 655. Why does SA Child Care Block Grant increase by $19 million?
Oh, yeah, New York State increased their allocation to not just us, but quite a number of counties based on the anticipated higher enrollment, especially with the loss of the former facilitated enrollment program.
Thank you. And then through the chair, so why does the SA preventative protective 65% increase by $3 million?
So that really is, preventive protective is the only expense-driven revenue on this stream. You know, we book the revenue in this account just for convenience. It comes in a state settlement that you really can't separate. So that when you spend $1 on preventive, you get a percentage back. It's not really 65% anymore. It's 62.7. But that's increased spending drives increased reimbursement.
Gotcha. Thank you. Through the chair on page 656, why does FA refugee entrance increase by $170,000?
Mr. Chairman, I think that's just based on a projection of trends we have been seeing over the past 2-3 years. I'll note our actual expenses in 22 were almost $430,000. It's quite a jump.
Okay. Also, through the chair to the administration on page 656. Also, why does state aid decrease by $347,000?
State aid on this particular page. Actually, I'll probably have to follow you up with you. I don't have a note on that one. We generally don't book revenues to just blanket state aid. We have revenue codes. So this was probably a derelict entry in the 23 amended budget that is more appropriately budgeted in one of the different lines.
Thank you. Through the chair on page 657, why does miscellaneous revenue increase by $180,000 and what does that cover?
All these are refunds and repayments of assistance, Mr. Chairman, and they're due back from the recipient of those dollars.
Through the chair on page 658. Sorry, knew that was coming. Did we receive a commitment on getting over $4 million from the state as part of the Children's Center expansion, or did they give us that after the expansion was approved?
It was part of the approval process, Mr. Chairman.
Okay.
They don't send us a check, Mr. Chairman. their reimbursement for capital projects for the detention center come in the form of, it's the wrong phrase, but I'm gonna call it an add-on to our reimbursement rate. But at least the state is well aware and agrees that because we only bond for a maximum of 20 years, which is shorter than what the state would normally reimburse us, they agreed to a 20-year schedule for that add-on.
Excellent. Through the chair on page 659, why does the FA refugee entrance increase by $390,000?
Again, Mr. Chairman, every case recorded in the welfare management system is coded by a category of assistance. And based on what we've been seeing over the past couple of years, that is driving just additional revenue.
Through the chair on page 660, why does FA EAF increase by $2.4 million?
A lot of that, Mr. Chairman, is reflective of our actual expenses. And when it comes to EAA and EAF, a lot of that is homeless services.
And then I don't know if you can even answer this question through the chair on page 60. Why does state aid also increase by $3 million for that?
That specifically I know is the Project Anchor grant.
Thank you. Through the chair on page 662, why is state aid for daycare revenue being eliminated?
This line, Mr. Chairman, really related to the facilitated enrollment program, which ended, and now the children are just being folded into the low-income subsidy program.
Through the chair, why is there hundreds of thousands in increases for FA foster care, adoption subsidies, refugee entrance, state aid, and foster care?
All those revenues, Mr. Chairman, are derived from the welfare management system and the youth category of assistance. So how those are coded in our welfare management system drives the reimbursement.
Thank you. Through the chair on page 670, why is there an increase of over 50% on state aid for runaway homeless youth?
We get specific allocations from New York State, specifically for runaway homeless youth, positive youth development, and youth sports. So this is really reflective of the allocations received and to be received from the state.
Thank you. Through the chair on page 671, why does state aid increase by $556,000?
Again, this is really related to direct allocations from New York State that we turn around to provide our funding to our direct service providers.
Thank you. And then through the chair on page 673, why does federal aid decrease by $3 million?
I do want to comment, when it comes to the Youth Bureau, you'll see annual increases or decreases. And I know I'm only going to make a comment because, last night we had a referral to accept a grant and it was $200,000 less than last year. And why did it go down? These are not performance based. We don't do a bad job, therefore we get less money, or we don't do an awesome job and get more money. These are really formula driven based on our population and the portion that are youth under a certain age. So I just wanted to be clear on that. And of course, I just lost track of the question, Mr. Chairman.
No worries. Page 673, federal aid decreases by $3 million. And then I'll just ask the same thing. SAOA, SAS increased by $2 million. Any reasons for that?
So these are not performance related, Mr. Chairman. New York State generally passes through to our Office of Mental Health funding for our direct service providers. And those really are tied directly to those.
Okay. Through the chair on page 724, referring to the youth detention workers positions, do we have candidates for those 15 additional employees that we're looking to hire there?
We do.
Excellent. Through the chair, also on page, all these are 724. Have you filled any additional supervising examiner, senior examiner, or examiner positions?
Through the chair, we're actually in the process right now. We recently received the test scores and we are canvassing and interviewing for those positions. 7 additional seniors and I think one supervisor at this time. Through the chair.
Excellent, thank you. And through the chair, why is there no increase in the number of caseworker positions? Is this because they are not currently all filled?
Hi, through the chair, we're actually increasing caseworker positions due to a discontinuation of a guardianship contract that we have with Catholic Charities. We are adding 4 caseworkers, a supervisor and a senior, as we now have to absorb the guardianship work under Adult Protective Services, but they hold the title as a caseworker.
Gotcha, thank you. Through the chair to the administration, kind of shifting over to Monroe Community Hospital now. Are there mandated versus unmandated costs for Monroe Community Hospital?
Mr. Chairman, we'll follow up on that prior to the Ways and Means Committee.
Thank you. Through the chair, can you I don't even answer that question. Through the chair, pursuant to referral 23-0376, authorizing a CNA training program. Just curious on where we would find these funds in this year's budget.
They are in there, Mr. Chairman. I just got to turn to the page.
Thank you.
Half the book is numerical order, the other half is alphabetical. Mr. Chairman, it's within our professional services line at the hospital.
Great, thank you. I yield the floor.
Thank you. Legislator Brew.
Yes, thank you, Chairman Heller. Through you to the administration and continuing on questioning regarding Monroe Community Hospital. To the chair of the administration, on page 220 last year, you listed completing renovations to Friendship Place as a major objective, but have it again this year for 2024 major objectives. Is this project behind schedule?
Through the chair, the Friendship Place project is somewhat behind schedule. It is underway. We have begun the demolition in the facility for that space. We anticipate the project to be complete for 2025.
Thank you. And to the chair, to the administration, other listed objectives from last year include resuming a dialysis clinic on site, resuming special events, and obtaining funding for renovation of facility playground, but were not listed under major accomplishments in the proposed budgets. Question would be, were these goals achieved?
Through the chair, unfortunately, those objections were not achieved. We have been unsuccessful in securing a provider to occupy the space in the dialysis center that facility that's left. And we are still working on grant opportunities to fulfill or rebuild our playground area.
Okay, thank you. Just a follow-up question to that, to the chair of the administration. So of the three I mentioned, which were the dialysis clinic on site, resuming special events, and obtaining funding for renovation of a playground facility, they're still on the radar. Is that true?
That's correct. They're still on the radar. We are still working feverishly with other sources to identify providers for the Vicinity site. It's a much needed service for not only for our facility, our residents of our facility, but the community as a whole. So yes, all those are still on our radar.
So, I'm sorry, one more follow-up question. No, I'm not sorry. To the Chair of the Administration. So of the three initiatives there between the dialysis and the special events and obtaining funding for the playground, which one would you consider to be highest in priority?
Through the chair, I would say securing a provider for the dialysis center would be of our highest priority right now.
Thank you. Through the chair, for 2023, a major objective was listed to keep the average census in the pediatric unit over 80%. But that is not listed as a major accomplishment in this proposed budget. This proposed budget also has the objective of keeping it over 90%. Was this number achieved in 2023? And can you explain why your goal is now 90%?
Through the chair, the overall census in the PEDS unit has been hovering right around 80%. We are looking to increase that due to the need in community and the possible bandwidth. We're also looking to restructure or retool the area so we can take on more pediatric patients or residents in the facility.
Thank you. Now on to some appropriation questions. To the chair, to the administration on page 221, why are personal services costs going up so much?
A lot of that, Mr. Chairman, is reflective of refunding those 29 positions that were defunded last year. Now all their positions are funded, and of course, there are the contractually obligated pay and step increases. And I will reiterate what I mentioned in my presentation. We did, after the fact, apply a general 9% vacancy factor on their positions.
Thank you. Through the chair of the administration, now on to page 549. Why do salaries increase to 5 million?
That, Mr. Chairman, is reflective of the fully funding of their positions. There are 7 new positions, by the way, and reflective of those contractually obligated pay and step increases.
Thank you. And through the chair of the administration, what software is now, and this is continuing on page 549, what software is now being licensed for almost 500,000?
That's their Vision, Mr. Chairman, Vision electronic medical record. We are budgeting that as software license, and you'll see at least a small reduction in a corresponding line maintenance of computer equipment. I will also note this line is not all the electronic medical record. It does include their nurse call system, their system for security, and some software used by the cafeteria staff.
Okay, thank you. And a follow-up question to the chair of the administration. So is this software currently in use, or is this anticipated purchase to be implemented?
The electronic medical record has been deployed in, 2019? Yes, around 2018, 2019.
Continuing on page 549, to the chair of the administration, how will the $250,000 for recruitment be spent?
Can you give me a line, Mr. Chairman? Oh, I'm sorry. I found it, Mr. Chairman. Recruitment expense. This $250,000 is entirely related to New York's healthcare worker bonus program.
Thank you. Next question on 549. What is bad debt expense? Is it a new line and a $750,000 increase?
Yeah, it is new in this budget, Mr. Chairman. It should always have been there. Whether you're a nursing home or an acute care facility, you have private pay patients, in this case residents, who just don't pay their bill. The hospital should always be budgeting bad debt. I know because of their cost reporting requires the hospital to net bad debt against revenues. That's a standard for cost reporting. It's not a standard for financial accounting and financial reporting. So the hospital broke out an estimate of next year's bad debt expense.
Okay, thank you. And through the chair to the administration on page 550, why is the cost of medical lab supplies going up by almost $600,000?
Some of that, Mr. Chairman, is timing. Depending on when purchase orders, and a lot of their stuff comes from Pandion, I realize that. But they maintain an inventory and a stock room. So honestly, depending on when orders are actually utilized, that's when the hospital recognizes the expense. About a 1.5 million is what they have been, based on the resident census over the past 3 years experiencing. So this is at least in line with where it should be.
Okay, thank you. Through the chair of the administration on page 551, why are several interdepartmental chargebacks increasing by so much, especially the human resources and purchasing?
Well, I'm not sure which lines you're looking at. It could be the ICAP charges. ICAP is our indirect cost allocation plan. Those are identified in this page by the prefix IC1 and IC2. I've mentioned in other meetings, there is a 2-year lag on our ICAP. The budget for 2024 is based on the work done in the summer of 2023, in which we have to use the actual expenses from 2022. So they are accumulated in each department. We do follow the federal guidelines on indirect cost allocation. So really it is all formulaic and based on the work produced by our staff departments and how it was consumed by user departments. Charges for information services generally are on the rise across the county. Significant increase in information services budget going into 2024 to better address cybersecurity issues and general network production issues.
Thank you. Now I want to a couple of revenue-related questions on page 682. What is the miscellaneous revenue that is increasing by about $800,000?
There are a few things that we book to miscellaneous revenue, specifically MCH, I'll call them resident services, like the hair salon, the barber. There's a number of those. The budget for 24 is actually looking to go up based on an increase in the actual resident census we have. It's a little lower from the 23 budget, don't get me wrong, because I think in my presentation, I mentioned the budgeted average resident census next year is higher than what we have today, just a little bit lower than the 23 adopted budget reflected. Also in here is our lease of space, both to outside agencies and some internal departments, like the Youth Bureau, Office for the Aging is over there. I think I mentioned in a few minutes ago, MCH acquires a lot of their medical and lab supplies from Pandion. That is a group purchasing company located right here in Rochester. Based on the size of our orders for the year, we do get a rebate from them, about $750,000 in next year's budget. And then, of course, there's all other. Now, the all other is usually in that $100,000, $200,000 range, but for the 24 budget, we included that $1.2 million of TC3 funding. TC3 funding is from Finger Lakes Provider Performance System. I might have that backwards. Essentially, our area hospitals, the acute care facilities, have high need patients occupying beds that are ready for discharge. They just can't find a nursing home bed. Why? Because they're very high need. So the TC3 program is providing non-patient specific funding for local nursing homes to accept a certain number of those discharge-ready patients. For MCH, they're budgeting $1.2 million.
Yes, thank you. To the chair, continuing on page 682 under bond proceeds, the question is, why is the transfer from general fund increasing by over 3.5 million?
Mr. Chairman, that is reflective of real life. A lot of nursing homes are in the same boat as MCH in that we have a heavy reliance on Medicaid as a payer. Medicaid is not the best payer. They're like any other private insurance company, right? You submit a claim and the first action is deny. So then you got to follow up on that. They are also horrendous. They have horrendous reimbursement rates. So absent the ability to collect what New York State should be paying for their own care, we are providing a general fund subsidy to MCH to balance its books.
Thank you. And if I could just comment on that, I think Monroe Community Hospital is a local gem in our community, whereas we have many similar areas in our state that have just abandoned our local community hospitals. And so I've always felt this at MCH was a needed facility for many people that have those special medical needs. And so I wholeheartedly support the county propping up MCH and doing what it can to keep that facility a viable operating facility. Personnel questions on to page 728. Why has the total number of LPN positions through the chair of administration, why has the total number of LPN positions at MCH gone down?
Through the chair, there's been a slight reduction in the number of LPN positions in MCH. As we've requested to reclassify some of those positions to allow us to fill a greater need in our CNAs, in our CNA training program. LPNs and RNs right now and the nursing our numbers as far as our PBJ numbers are sufficient, and we are making or meeting our state required staffing requirements, but we struggle with our CNA positions.
I'm sorry, you struggle with
hiring into the CNA position and having enough slots.
Next question, through the chair, while the overall full-time employees increased by only 4.25%, there seems to be a lot more salary dollars. Can you explain this?
Through the chair, with the reduced number of staff and the positions, and us having to, again, meet these required staffing numbers, we have to rely a great deal on overtime, agency, and other means to fill the nursing staff positions.
Moving on to the Department of Health. General question through the chair. What are the percentages of mandated versus unmandated costs for the Department of Public Health? If I can read Mr. Franklin's mind, it might be 99.9%.
Not in public health.
Okay.
But it is a statistic I don't bring to these meetings and don't generally refer to very frequently. So it is something we can query the budgeting system, so we'll follow up prior to the Ways and Means Committee.
Next question, general question on page 280. Why did the fee for a dental ID rise so much?
Mr. Chairman, specific to dental IDs, other counties, we do contract out that service with a dentist, a local dentist. That dentist has increased his prices. We have to pay, so we have to pass that along.
Okay, thank you. Now, a couple of performance questions to the chair of the administration. Objectives for 2023 included increasing PrEP engagement for HIV by 2%, but the accomplishment on page 268 said it was 1.3%. Is there a reason the goal was not reached, and are you again hoping to increase by 2% again this year?
Could you repeat the question for us, please?
Absolutely. Through the chair of the administration, objectives for 2023 included increasing PrEP engagement for HIV by 2%. But the accomplishment on page 268 said it was 1.3%. Is there a reason the goal was not reached? And are you again hoping to increase by 2% this year?
Through the chair, we set an aggressive goal for 2023 of 2%, and we did not reach that goal. We did reach 1.3, which we think is good, but we're going to aim for 2% again next year.
Thank you. Through the chair, to the administration, on page 290, why is $900,000 of fund balance being allocated?
Ed, anyone brought their 22 annual financial statements with them tonight? You could see footnote 1 has a list of all our assigned fund balances, and we had $900,000 of assigned fund balance specifically for early childhood development services. Since there was a tremendous rate increase allowed by New York State for tuition and itinerant teachers, we applied that $900,000 of assigned fund balance to this particular division.
Thank you. To the chair, to the administration, on page 291, why is the IFSP completion percentage projected to be lower than last year, and what can we do to increase that percentage?
Through the chair, the reason why we're not able to attain that goal is because we have a shortage of providers who are qualified to do those evaluations.
And a follow-up question to the chair of the administration, are there initiatives in play to identify qualified providers to achieve those goals?
Through the chair, we're experiencing a shortage across the state. The state has been advocating for an increase in rates for early intervention providers, and we hope that goes through. But failing that, we have a shortage of providers all around. So our hope is with a higher rate, we can recruit them away from hospitals that pay a greater rate, but that remains to be seen.
Okay, appropriation questions to the chair on page 269. Is the Friendship Place carryover? And what is the status of that project?
Sorry, Mr. Chairman, can we have just a moment, please?
Through the chair, if you could repeat the question, please.
Yes, on page 269, is this Friendship Place carryover and what is the status of that project? We're talking about the Friendship Place renovation soon.
Well, the status through the chair, the status of the Friendship Place project is, again, we are currently in the process of beginning demolition of it. We have had architectural designs and drafts drawn up for the facility, and in the process of securing the appropriate materials, services, and through proper procurement to begin service work on the area.
Okay. Thank you. A follow-up question on that through the chair of the administration. So remind me, the Friendship renovation was that targeted to rental space, to outside entities, or was that targeted for in-county support services?
Through the chair, Friendship Place is targeted to existing and county residents who need a higher level of care on a unit that is a dementia unit. Friendship Place is designed to be more resident friendly, although it is a lockdown unit, but it's more open, providing residents with private sanctuaries, private rooms, and more autonomy within the area, but still remain in a lockdown dementia unit.
Through the chair on page 272, why do personal employee benefits decrease but number of employees increase?
In this particular case, Mr. Chairman, the 23 amended budget included $104,000 related to our pandemic response. It also included $1.77 million in other state and federal grants. So the amended budget is really just that much higher.
Thank you. And on the same page, through the chair to the administration, why are the appropriations for administration special services decreasing by about 3.4 million?
So, Mr. Chair, within administration special services is our impact team. It is a team of 34 individuals. However, they have a number of vacancies right now that they do not intend to immediately fill, and they have defunded 6 of them in the 24 budget. I will also note that the 23 amended budget is actually higher due to the inclusion of $2.6 million of pandemic response funding and $1.3 million in other state and federal grants. And those, is I think everyone knows, throughout the year, Health Department comes to the legislature to appropriate grants. So the proposed budget for 24 will eventually be amended upwards as it is each other year.
Thank you. And one more question on that same page to the chair of the administration. Why is $900,000 of fund balance being used?
This, Mr. Chairman, reflects the $900,000 of assigned fund balance back in 2022 for early childhood development services.
Thank you. On to page 273, to the chair, to the administration. Why is there no federal aid listed?
There will be, Mr. Chairman, later on in 24. The 23 budget was amended to accept $1.3 million in the Public Health Emergency Preparedness Grant.
Okay, and a follow-up question to that, through the chair of the administration. When is that federal aid typically received?
A good question, Mr. Chairman. None of us here know the answer, so we will follow up prior to Ways and Means Committee.
Well, to the chair of the administration, there's no point in answering a question that no one knows the answer to. So I get it. So on, continuing on 273, can you explain the reduction in personnel and contractual services while the total number of employees is increasing?
Thank you for recognizing that the number of employees is increasing. I will say the 23 amended budget is that much higher because it included $729,000 of pandemic response funding, in addition to $198,000 of grants that had been accepted during the year.
Okay. And on page 274, through the chair to the administration, and take this question for what it's worth, is there a concern that the number of births and deaths in Monroe County are about even?
Through the chair, that pattern has been the case for many years now. We are essentially, from a birth and death standpoint, holding neutral.
Let me see, next page, 277, through the chair to the administration, why the significant decrease in maternal and child health services?
Maternal and child health services are heavily funded for the WIC program, the grants we receive, our Nurse Family Partnership, and Starlight Pediatrics. The big decrease you see in the proposed budget versus the amended budget for 23 is really related to the amended budget having $2.85 million in grants accepted during the year.
And a related question to that, to the chair of the administration, what would you attest the significant decrease in the federal aid?
Federal aid, that is our WIC funding, Mr. Chairman. So that will be coming to this legislature.
Thank you. On page 278, to the chair of the administration, the target WIC caseload is 100%, but it was 127% in 22, 23. Could you explain those numbers, please?
Through the chair, the WIC caseload was increased due to factors out of our control. And so we're aiming for hitting 100% of the new target, which is essentially 127% of the previous target.
Thank you. Through the chair to the administration, referencing page 283, why is the 2023 amended budget for personal services so much higher than the proposed? And do you foresee the same thing happening this year?
We do, Mr. Chairman. Environmental health is grant funded to a certain extent, and personnel services for 23 included $828,000 worth of those grants, which should be coming before the legislature throughout the year.
You and to the chair to the administration, is there a reason why there is only state aid and no federal aid for environmental health?
Environmental health is heavily federally funded, and that is a grant that will be coming to the legislature.
Thank you. To the chair on page 292, to the administration, why are the interdepartmental charges almost doubling for the epidemiology disease control division?
Predominantly, Mr. Chairman, that's related to the higher budget for 24 within our information services department.
Thank you. Through the chair of the administration, referencing page 534. There are several increases: travel, licensure fees, occupational exams, commercial services, professional services, service computer, and agency contracts. Can you explain each of the above?
You probably have to reiterate them, Mr. Chairman. I can start from the top and work my way down, and if I
Well,
miss
No,
something.
to the chair, is there a general explanation that would cover those? We don't need to belabor everyone individually.
A lot of the changes from 23 to 24 reflect to slightly different budgetary decisions within the impact team in what they are proposing to structure their services going forward.
That's satisfactory. Thank you. On page 535, why does recreational supplies get a line for an additional $20,000 in supplies and materials? And what does that involve?
That's really, again, related to the impact team and their outreach incentives for their strategy in 24.
Okay, thank you. And on to page 537, through the chair to the administration, the professional services line item is raising about $25,000 over the 2023 amended budget. However, the 2022 actual budget was more than 300,000 over the 2022 amended, and the 2023 proposed was 311,000, but ended up amended to 250,000. Can you explain the variability in these numbers? And I can read them again if you'd like me to.
I would suggest, Mr. Chairman, that the Division of Nursing Services does receive more than $500,000 in grants, as those grants have varying priorities and timing. The department amends their budget to fulfill the terms of those grants according to the performance measures of that grant.
Thank you. Mr. Chairman, I yield the floor.
All right, thank you. Legislator Morse, may I ask one question here before I head over to you? This was just a question I wanted to get answered before I forget about it, quite frankly. On page 549, sort of the bottom 1/3 of the page, there's an item MMIS Weekly Shares Report. Explain what that is, please. Just
This
a
is,
significant amount
I
of
like
money.
to, sorry if I'm flippant about it, but I like to refer to this as the government-sponsored money laundering program.
I'm sorry I asked.
So here's, it used to be called intergovernmental transfer. And that probably didn't sound, it probably sounded too much as I describe it. So it's now the Medicaid upper payment limit. So how it works is we have to pay New York State $1. This is all pursuant to a state plan negotiated between state DOH and federal CMS. So it's all government sponsored and agreed to. We have to pay New York State DOH $1. New York State gets $1 from federal CMS and then sends $2 to Monroe Community Hospital. And because the general fund is providing such a significant tax subsidy to the hospital, we expense our dollar that we have to pay in to the hospital. It has to be non-federal dollars. That's
Money launderers that actually pay us.
yes, we give the state $1 so that they will turn around about 2 weeks later and send us $2.
Right. I think I've got it. Thank you. Legislator Morse.
Thank you. Through you, Mr. Chairman, to the administration. On page 538, why does computer software drop by 257,000? And what was purchased last year?
Computers. On page 538, Mr. Chairman, we had a budget for computer equipment, not computer software. And it was only $6,320. That was barcoding equipment that was acquired in 23.
Then I'll move on to page 539. Why do salaries drop by 44,000?
All of this, Mr. Chairman, is related to grants that will come before the legislature for acceptance during the year.
And through you, Mr. Chairman, again to the administration on page 540, the information services interdepartmental chargeback continues to go up quite a bit each year. And this seems to be true across the entire budget. Can you explain this?
That's the additional, in ballpark, $3.5 million addition to the information services budget, Mr. Chairman, for 24. So that is spread to all the user departments.
Thank you. And again, through you, Mr. Chairman, on page 541, why is software licenses added as a line item for an additional 37,000?
This particular line, the dollars were moved from a different account in supplies materials, 505020, which is our computer software account. This is for their medical software. I think it's called Dragon. You basically speak to it and it puts your words into print. It also includes licensing costs for the medical examiner's case management software and a product called Qualtrics. Maybe that is their case management software.
And again, through the chair on page 542, debt service is going up over 100,000. Is this for a project?
Mr. Chairman, that was the project to renovate the medical examiner's office in the Ames building over by MCC.
And then again, on page 542, through you, Mr. Chairman, why does computer software decrease by 25,000?
All those dollars, Mr. Chairman, were moved to software licenses.
And again, through the chair on page 543, why are salaries increasing by 200,000?
Mr. Chairman, that really is entirely related to grants accepted during 23 that will also come before the legislature in 24.
Again, through you, Mr. Chairman, on page 543, why are agency contracts increasing by 310,000 from the 2023 proposed budget?
That, Mr. Chairman, is the money public health will be paying to the city of Rochester for lead paint testing. That's the grant from New York State that has gone away.
And again, page 547, through you, Mr. Chairman, to the administration, epidemiology and disease control. Why do salaries increase by 40,000? And additionally, why is this public health department continuing to expand far beyond its pre-pandemic levels?
Interesting, Mr. Chairman, epidemiology has actually reduced its headcount by 1.6 FTEs. So the increase you see in salaries is entirely attributable to the contractually obligated pay and step increases.
And so in 2021, again, through you, Mr. Chairman, the actual salaries were at 312,000 and change and now stand at 575,000 in change in the 2024 budget. Is that based on contractual obligations?
Mr. Chairman, 21 is a very unique year. I don't have 21 detail in front of me, but I'm, for this committee, going to hazard a guess that those salaries were, instead of charged to epidemiology, were instead charged to the CARES Act. And we accounted for the CARES Act in finance unallocated, 120902.
Final question on that line through you, Mr. Chairman. Can we have the last 10 years or so of actual salaries?
I can produce that, Mr. Chairman. It's not going to be valuable information. Public health in my 10 years has had 2 reorganizations and shifting of staff. I don't know how reflective it's going to be for evaluating the 24 proposed budget.
And then continuing on through the chair on page 675, why is FA Medicaid decreasing by 1.4 million?
That, Mr. Chairman, should not have been there in 23. That was budgeted funds from the Medicaid salary sharing revenues that are deferred revenues over in mental health, and it's attributable to the impact team. That really should have been budgeted as charges to trust funds, which is a little lower on that page, which is why you see that particular line almost double.
And then again, through you, Mr. Chairman, page 675, wire charges to trust funds increasing by 1.5.
It was just asked and answered, Mr.
Oh,
Chairman.
apologize. Through the chair on page 678, why is state aid decreasing by 78,000?
This particular line, Mr. Chairman, is a grant that typically comes to medical examiner that should be coming before the legislature during the year.
And again, through the chair on page 679, why is state aid increasing by 310,000?
Oh, Mr. Chairman, that's our Article 6 funding. Interesting, just recently, New York State now also reimburses a portion of fringe benefit costs, not for all the staff, but for the majority of the staff. So that's reflected in the higher revenue budget.
And again, through the chair on page 679 to the administration, why is SAPH Article 6 decreasing by 200,000? And what is this exactly?
Sorry, Mr. Chairman, I think the legislative aid picked the wrong line. It's not decreasing.
Oh, it's increasing?
Our Article 6 is increasing. The amended budget was about 481 grand. Going into 24 because of the change, it's about $707,000.
Thank you. Again, through you, Mr. Chairman, to the administration, are there any further plans to expand the medical examiner's office to help handle the caseload with personnel?
You can see in the associate medical examiner position, for which we are actively recruiting. We continue to have our forensic pathology fellowship program, also a potential source of medical examiners in the future. And I'll be working with Dr. Granger over the coming year to develop their staff even further to ensure that they can provide the data as well as produce the reports that are vital for our overdose epidemic.
And again, through you, Mr. Chairman, to the administration, can you explain if there were any changes to staffing levels or groups? And if so, what were they?
Increased our medical investigator workforce as well as our toxicology workforce.
Then moving on through, Mr. Chairman, for regarding the Veterans Service Agency, I believe this will probably be something that Mr. Franklin will say we can be provided for Ways and Means. What the percentage of the department's budget is mandated versus non-mandated?
That is correct, Mr. Chair, prior to Ways and Means.
And again, through the chair, how much, if any, general fund balance is being applied to the VSA's budget? And if general fund balance is being applied, what's the breakdown of restricted versus unrestricted?
There's
applied
no,
fund?
Mr. Chairman, there's no fund balance within the Veteran Service Agency.
Thank you. And through you again, Mr. Chairman of the administration, what is the breakdown of the VSA budget as it relates to appropriations charged to the general fund, debt service fund, and capital projects fund?
Let me just flip to the page, Mr. Chairman. Mr. Chairman, the veterans budget, $1.6 million in appropriations is all within the general fund. What did that question? Did I miss something?
Let's see, versus it relates to appropriations charged to the general fund, debt service fund, and capital projects fund.
Yep. So all of it is general fund. Their VSA has no debt service, therefore there's nothing accounted for in debt service fund. And there's no provision for capital that would be transferred to a capital project fund.
Thank you. Through you, excuse me, Mr. Chairman of the Administration, on page 338, why was last year a major objective listed as a county service officer at VOC, provided assistance to 232 veterans at the VOC, and in this year's budget of accomplishments, it states that the county service officer at the Jordan Health Center on half-day per week presence had 98 contacts with vets. Is this position no longer in-house at the VOC or full-time, or why this decrease?
Through the chair, around the turn of 23, the officer who was filling the position at the VOC left for other employment. We hired his replacement, and she started around the 1st of April. However, it took several months to go through the training and accreditation process, and then having access to the VA software systems that we use, because we get accredited through, anyway, we access VA databases. So she finished that process in, say, early to mid-October. So she wasn't able to be fully employed at the VOC, and she is now working there full-time.
Thank you. Regarding appropriations, through you, Mr. Chairman, on page 340 to the administration, is there a difference between contracted services versus personnel due to the fact that we're adding employees versus contracting?
Well, you do, Mr. Chairman, we'll see a shift, right? We won't have our contract with Tribe Ecotherapy, and it is primarily the reduction in contractual services. And because we are insourcing that, that is, plus the drug court position, is why you see the increase in personnel services.
Thank you. Again, through you, Mr. Chairman, to the administration, under performance measures, why are we expecting a decrease in clients and recovery?
August 2022, President Biden signed the PACT Act, which expanded eligibility areas and eligibility conditions for service connection. So into 22 and through 23, we had we'll call it a spike in clients that came to the agency. We anticipate that to go back down from the spike, but still remain above previous levels.
And through the chair on page 552, salaries are increasing. That line is increasing over $155,000 in 2024. What is the reason for this increase?
It is all, Mr. Chairman, related to that full-time addition, plus the contractually obligated step and pay increases.
Thank you. And again, through you, Mr. Chairman, to the administration, temporary help is increasing from 21,000 in 2023 to 170,000, excuse me, in 2024. What's the reason for this increase?
Yes, Mr. Chairman, those are related to the part-time positions, primarily related to the ecotherapy program, but also that part-time drug court manager.
And again, through you, Mr. Chairman, to the administration, professional services is decreasing from over 600,000 in 2023 to 220,000 in 2024. What's the reason for this decrease?
This is professional services, Mr. Chairman, is where we had the contract with Tribe prior to insourcing it.
And then again, through you, Mr. Chairman, to the administration, medical lab supplies are decreasing from about 10,000 in 2023 to 0 in 2024.
So I'm going to let Dale tag team on this. I know this is related to drug court, and you had lost a medical provider for detox.
So the medical supplies has been a line item in the grant since the grant's inception. We were using a contract provider for evaluation and treatment for the veterans who are going through the treatment court, but we lost that provider. That wasn't a line that we could change because of the requirements of the grant. So it's been there unused for, well, since I've been with the county since 2021.
Thank you. And through you, Mr. Chairman, to the administration, on page 553, information services is increasing by 27,000. Why is that?
Mr. Chairman, all reflective of the increase in information services budget for next year.
A revenue question through the chair on page 683. State aid decreases from 137,500 in 2023 to 0 in 2024. What's the reason for that?
State aid, I believe federal aid is decreasing, Mr. Chairman. That'd be the Veteran Drug Court Grant that has gone away.
And again, through you, Mr. Chairman, to the administration, on page 737, under personnel, what was the reasoning for adding a Veterans Health Clinician Group 20, a Veterans Counselor Group 14, Veterans Court Manager Group 13, and a Veterans Therapy Liaison Group 12? And then are there any other changes to personnel?
First, through the chair, first to correct, it's a group 18 for the Veterans Health Clinician. So the Veterans Health Clinician and two of the other positions are going to be taking over and managing the nature-based therapy program for veterans, which was previously contracted and now will now be county run. The Vet Court Case Manager position was also something that was funded by the federal grant and was contracted out. Now that is becoming an in-house position, so that's another new position that's created. And then the Vet Court Liaison position was also funded by the grant that went away, and we're assuming that under the county budget.
And last question through Mr. Chairman to the administrator. Are there any other changes to personnel, or is this reflective?
No, I believe all the changes to personnel are reflected in what's in front of you, sir.
Thank you. I yield the floor, Mr. Chairman.
Further questions? Legislator Evelson.
Thank you, Mr. Chairman. Through you, I'd first just like to thank Franklin for his presentation to this committee. I have just a couple quick questions. The first one is regarding the revenue that comes into the Office for the Aging and Monroe County Youth Bureau. And I'm wondering if that is mostly state aid that then gets passed on to different senior centers, municipalities, youth service.
It is, Mr. Chairman. Almost all of it is direct pass-through aid.
Mr. Chairman, to the administration, has that funding stayed at the same?
Over recent years, Mr. Chairman, again, I'm going to throw that caveat about COVID. The state was throwing all kinds of money. This legislature accepted several COVID-related grants through our Office for the Aging. By and large, however, I think I made a comment a little while ago. We are seeing increasing state allocations for our Youth Bureau, and a lot of that is related to a greater emphasis on youth sports. And the New York State Office of Mental Health has been sending our county office of Mental Health additional funding as well. Most of that is mental health related, and then to a lesser extent, addiction services related.
Thank you. Through you, Mr. Chairman, you kind of touched on my next question. You mentioned, in addition, runaway and homeless youth money and YDDP money from sports money. And my question was whether that relatively newer pool of money from the other pools or whether it has indeed been new money.
Mr. Chairman, it's definitely new money to the county. I can't answer if it's new money to New York State. It is not a shift. It does not appear to me to be a shift in existing appropriations within the state budget.
That's fine. That's actually was my question. One more question I had through the chair. Whether in the departments covered by this presentation, human service, whether there are any contracts that will be ending 2024 that will have to be negotiated. So what assumptions were made?
That's a good question, Mr. Chairman, and the answer is yes. There are a lot of contracts that will be expiring in '24. Good number of them have renewals already contemplated ahead of time, at the time the original contract was executed, but then others are going to have to go through an RFP process. Generally speaking, departments start proposing for their budget what they proposed last year. And then they adjust up or down based on trends they've seen or information they've received from their state or federal partners, and for any inflationary factors that might be at play. So I know for Department of Human Services, we're seeing an increase in their purchase of service contracts for mandated preventive services, child preventive and adult protective. We know that the state is now bringing back work requirements for financial assistance, both TANF and safety net assistance. So the department has been increasing their contracts in the proposed budget for required employment assessments and alcohol and substance abuse assessments. And I think it would be fair to say, although I'm more familiar with Department of Human Services since I have a history with them, but I know Department of Public Health also contemplates those style of increases as well.
Question for Mr. Franklin, so I'm going to quit well. To my colleagues.
All right. Legislator Blunt.
Yes, thank you, Mr. Chairman. A question through you to the administration. Just curious, Mr. Franklin, in your presentation, you mentioned a couple of different programs inside Human Services where the number of cases are decreasing, but the average cost per case is increasing. Could you just provide an explanation as to what's driving that increase in cost per case?
I'll let the Human Services tag team with me, but I will suggest that the predominant reason we're seeing increasing costs per case is due to shelter costs, whether that's emergency housing placements or the supplemental rental payments that are being authorized in the welfare management system.
Yield.
Legislator DeVecchio Hoffman.
Hi, thanks. Through the chair to the administration, I just want to first congratulate Commissioner Wright and her team on being one of the best counties to spend the Project Anchor dollars and to actually use those. Something that we've advocated for the state for, and it's really disheartening when counties don't take advantage of that. So y'all have done a really great job at leading in that. Is any of the additional money coming from the state? I know from working with constituents on Project Anchor cases, some of there's a bottleneck because of staffing. And I know this isn't a county staffing, this is contracted out to Catholic Family Services. So I'm just wondering if the additional money coming from the state is sort of the same ratio as it's been, or is there more money coming for administrative costs so we can get those dollars out to constituents faster? Any changes?
Through the chair, yes, definitely advocating for any additional funding for Project Anchor. Most of the bottleneck that we're seeing is more related to the lack of landlords that have been open to accepting the rental supplements. We struggle with getting landlords to agree to that supplement, which causes some of the bottlenecking, which also causes longer lengths of stay in our emergency housing. As a result of the pandemic and the moratorium that was put in place, it has put some pressures and stressors on landlords that have not made them as risk averse for some of our clients. So looking at ways to incentivize, to engage landlords, to give them the opportunity to understand the supplement program. So we're working on some of those things, but that's the biggest barrier we have seen, not so much the funding or the availability of it, but really to get the landlords online to be able to be open to take the supplement payments.
is the additional money that's coming in, is it all going towards rental subsidies, or is some of it admin costs and some of it rental subsidies?
Some of it is administrative costs because we have a contract with Catholic Charities to do the program, to collect the applications and supplies.
And through the chair, and it's okay if you don't have this now, but is the breakdown of admin costs to rental subsidy the same as it's been before, or has it changed at all as far as the ratio of the dollars coming from the state?
We'll supply that for you. I have to just pull the contracts off.
No problem. Thank you.
Further questions?
This is about our veteran service agency. Again, want to say thank you for the way that our veteran services are in many ways leading the way in mental and emotional wellness, including suicide prevention in my district. I'm just wondering, there's a shift in contractual services to personal services. Is there a way that providing these services in-house is going to better benefit our constituents, or is there another reason for that?
Through the chair. So transitioning the nature-based therapy program to in-house was, I would argue, out of necessity based on some issues with the contractor, and there was no other vendor in the area available to provide those services. Transitioning the vet court case manager position into the court will also likely be advantageous to the veterans because it is a county employee whose sole purpose on a part-time level, but whose sole purpose is to do the case management for the veterans going through the treatment court.
Great. Any further questions? All right, Mr. Franklin and rest of the administration, thank you so much for walking us through this very complicated subject and for your deep knowledge and great answers. I guess we will now on to the remainder of the committee agenda. The next item is the approval of minutes. You have the October 24th, 2023 minutes before you. They will stand approved unless the clerk is notified of any changes by the end of the day. The next item on the agenda is new business. Mr. Clerk.
Referral 23-0371, authorize a contract with Vargas Associates for professional design services for the Department of Human Services Space Utilization Project.
Motion by Legislator Smith, second by Legislator Dondorf. Are there any questions? Legislator Smith.
Legislator Smith, can you just use the mic?
Sorry. Through the chair, to the administration, do you believe this is a good initiative at this time?
Through the chair, Sean Murphy, Chief of Engineering. Yes, it is. The lease that we have right now at 691 St. Paul is going to expire in about 3 years or less. And it takes at least 15 months to negotiate a new lease or find additional space. So as you just heard about all the work that goes on in DHS, and actually over the last few years, since 2015, they've increased their staffing by about 115 people. We want to make sure that they have sufficient space to occupy.
Thank you. I appreciate that. I yield the floor.
All right, thank you. Are there any further questions? All right, all those in favor, please signify by saying aye. Aye. Are there any opposed? Item carries. Next item, please.
Referral 23-0376, authorize a contract with Monroe Community College to provide a certified nursing assistant training program for new employees at Monroe Community Hospital.
Moved by Legislator Dondorfer, seconded by Legislator Morris. Are there any questions? Legislator Dondorfer.
Chair to the administration, why does MCH require a special program? Why can't it use the existing CNA program?
Through the chair, Monroe Community Hospital relies on MCC's nursing training program as we have not had our own nurse aid training program in the past to certify new CNAs for the position. We have recently just received approval from Department of Health to move forward with our own nurse aid training program. But our first class is slated for December of this year.
Thank you. And through the chair to the administration, why didn't the county use ARPA funds to fully support MCC's request for nursing training?
Apologies. Through the chair, could you repeat the question?
Yes, through the chair to the administration, why didn't the county use ARPA funds to fully support MCC's request for nursing training?
Through the chair, MCC's request was fully funded through a partnership with FLIPS. So FLIPS was the prime subrecipient for Monroe County's ARPA dollars. And then FLIPS subcontracted with MCC to ensure FLIPS program and MCC program was rolled out together in tandem. But we can get you more information to confirm that MCC's proposal was fully funded through that subcontract with FLIPS.
Thank you. And through the chair to the administration, were there any other respondents to the RFP?
Through the chair, no, there were not.
Thank you. I yield the floor.
Any further questions? Senator Hassman.
Add-on program, or is it in partnership with MCC? I'm sorry, you don't scratch that.
Any further questions? All those in favor, please signify by saying aye. Aye. Are there any opposed? Item carries. Next item, please.
Referral 23-0377, authorize a contract with Medicaid Recoveries to provide Medicaid application services for Monroe Community Hospital.
Moved by legislator Morris, seconded by legislator Brew. Legislator Morris, please.
To the administration, is this the first time an outside vendor is aiding the Medicaid liaison staff with this?
Through the chair, yes, this is the first time we've outsourced the services.
Thank you. And no further questions.
Further questions? All those in favor, please signify by saying aye.
Aye.
Are there any opposed? Item carries. Next item, please.
Referral 23-0378, authorize a contract with St. Anne's Management Company to provide comprehensive medical billing services for Monroe Community Hospital.
Moved by legislator Brew, seconded by legislator Smith. Questions? All those in favor, please signify by saying aye. Are there any opposed? Item carries. Next item, please.
Referral 23-0379, amend resolution 220 of 2018 to accept additional funding from the New York State Department of Health and extend the time period for support of the Monroe County Nurse Family Partnership Program.
Moved by legislator Smith, seconded by legislator Dondorfer. Are there any questions? All those in favor, please signify by saying aye. Aye. Are there any opposed? Item carries. Next item, please.
Referral 23-0380, amend resolution 412 of 2020 as amended by resolution 421 of 2021 and resolution 369 of 2022 to amend, increase, and extend the term of the contract with Rochester Regional Health through its Rochester General Hospital permitted laboratories to provide clinical laboratory services for the Monroe County Department of Public Health.
Moved by legislator Dondorfer, seconded by legislator Morris. Are there any questions? Legislator Dondorfer.
Chair to the administration, should the legislature expect additional increases to existing contracts due to the increased cost of testing or personnel?
Through the chair, we expect that during next year, there may be additional costs that would be grant supported if they occur. The proposal that's in front of you now is for an increase for the current year with the 2 subsequent years included with the existing funding that we know that we have.
And thank you. And through the chair to the administration, is this increase in costs driven by the arrival of asylum seekers in Monroe County?
Through the chair, yes, some of the cost increase is due to the arrival of asylum seekers. And there is funding that is also included tonight to support that.
Okay, thank you. I yield the floor.
Any further questions? All those in favor, please signify by saying aye.
Aye.
Are there any opposed? Item carries. Next item, please.
Referral 23-0381, amend resolution 429 of 2020 to amend, increase, and extend the term of the contract with the University of Rochester Pulmonary Group for the Monroe County Department of Public Health Tuberculosis Control Program.
Moved by legislator Morse, seconded by legislator Brew. Legislator Morse, please.
Chairman to the administration, is this increase in cost driven by the arrival of asylum seekers in Monroe County?
Through the chair, this referral doesn't actually represent an increase in cost. It represents the addition of 2 more years of your approval on the contract.
Got it.
Noted. Thank you. Any further questions? All those in favor, please signify by saying aye. Aye. Are there any opposed? Item carries. Next item, please.
Referral 23-0382, acceptance of a grant from the New York State Department of Health for the tuberculosis testing for asylum seekers program.
Moved by legislator Brew, seconded by legislator Smith. Are there any questions? Legislator Brew.
Yes, thank you to the chair of the administration. How will the use of these funds be monitored to ensure costs do not exceed the grant amount?
Through the chair, we monitor all of our services very carefully because we have funding coming from another grant that supports some of our tuberculosis control program services. And we have some county funded services. And so we are used to tracking what goes where and what cost is supported by what fund.
Okay, and through the chair to the administration, would you expect the county to receive additional grant funds should the cost of the program exceed this grant amount?
Through the chair, we have really no way of knowing what the state might provide to us in the future. Right now, they're providing what they believe will cover our costs. And we have devised a budget that actually supports this.
Thank you. Through the chair to the administration, are the migrants tested for other communicable diseases?
Through the chair, the migrants are in fact tested for other communicable diseases, but that is not a role that we have. That's a role that another agency takes.
To the chair of the administration, I didn't quite hear the end of that response. That's a role that who undertakes?
There are other agencies involved in this population, and so this is the testing for other communicable diseases is not done by our county clinics.
So, to the chair of the administration, how many of the asylum seekers are currently housed in Monroe County?
Through the chair, our last census update, our understanding at the Holiday Inn is 139 people.
Thank you. And through the chair, just curious, how many have left since they have arrived? Chair to the administration.
Through the chair, we can get you that information. I don't have that exactly now. Some residents, as you might be aware, have moved out of the hotel into permanent housing, which is funded through the state's MRAP program.
Thank you. Through the chair of the administration, are any new currently approved or proposed plans with the county, or the only one is still with DocGo at the Holiday Inn?
Through the chair, that's correct. The only approved plan remains through DocGo at the Holiday Inn, and we have not received any other proposed plans to review.
Thank you. Through the chair of the administration, so are we anticipating any additional arrivals next year or for the year's end?
At the moment, we have no confirmation that we will have any new arrivals. I guess I can't speculate as to, what might happen later in the year or next year.
So to the chair of the administration, just sort of a follow-up question for all the previous ones I've asked in regards of county funds expended to support the migrants. At the end of the year, should the county be able to look at the costs incurred for the county in total for the various different services provided and come up with a final cost to the county that we did bear for the purpose of supporting the migrants?
What's your point of order?
I think we're straying from the relevance of the referral.
No, I think this is the final question, and it's really relevant to the cost to the county and what's going to be covered by the grant. So I'm going to allow this.
Chairman, due respect, the referral says that this grant is 100% funded by the state and that there's no net county support required.
Right, and the question is just further clarifying the fact whether or
And that's
not there's
beyond the
county
scope of
support.
the referral.
And I'm going to.
Point of order, Mr. Chairman,
please.
doesn't the legislator need to appeal the ruling of the chair, not continue on with additional?
I've denied, thank you, I've
Okay.
denied the point of
Thank you.
order. Please continue. So just to reiterate, the question was about the total cost to the county at the end of the year related to services.
Through the chair, we can track direct costs to the county. I think as perhaps we've discussed before, we are not tracking personnel time.
Any further questions? All right, all those in favor, please signify by saying aye. Aye. Are there any opposed? Item carries. Next item, please.
Referral 23-0383, authorize intermunicipal agreements with other counties for services provided by the Monroe County Office of the Medical Examiner.
Moved by legislator Smith, seconded by legislator Don Dorfer. Are there any questions, legislator Smith?
Through the chair, Bob Zerby from the Medical Examiner's Office, Chief Investigator. If you would, your question again?
Absolutely. So through the chair to the administration, have wait times for cases been reduced in recent months?
We're trending essentially the same as we had last year.
And by doing that, trending the same, are we okay to take on other county cases? Does it impact our cases at all?
Through the chair, that a really interesting question. There is likely some effect on our county by taking in additional cases. However, if you look to the bigger picture, essentially the counties that we take are coroner counties. They're elected people who handle death investigations, then they really lack the forensic facilities to do the actual autopsy. By providing these services, we are assuming kind of a big brother, big sister role to the community, specifically to this entire region of New York State, to ensure that there's proper forensic services. Geographic boundaries are a thing. However, when it comes to people having death, it kind of transitions borders. So it's kind of good for us because it keeps our thumb on what's actually going on in our community at a larger scale.
Thank you so much. I do have a follow-up question to that through the chair to the administration. The IMA that we have, is it for, are we paid back for case by cases? Or is it a blanket? How does that work?
Okay, so through the chair, there's different levels of examination. There are full, complete autopsies, and then there's something called blood and description, which essentially is what we have when we go to the doctor. They look at you from the outside, do laboratory work, and they confer a diagnosis that way. The counties that we contract with, they are billed in two types. Type one is they prepay ahead of time, receive a slight premium for giving us money upfront to cover a certain number of cases. If they exceed that number of cases, then they're billed at the not special rate of whatever they exceed general. If they are a county that's type two, they basically pay as they go and they have no rate reduction in what they submit. That's helpful for us in the sense of budgeting because we know they're going to budget for $100,000 worth of cases. There's unknown $100,000 worth of revenue. There is no refund if they don't use all of their cases. So that is a service that's billed through. Our goal is always to ensure that in no way does Monroe County subsidize the work we perform for other counties. I did hear in an earlier question regarding why there was such an increase in the fee for dental. For years, we had paid the dentist $90 for an examination, and essentially we couldn't find a dentist because the market throughout the U.S. is closer to 500. He was able to settle at 400, which is what they reimburse us for. And the 75 covers our staff who handle things like x-ray and the actual physical processing of the decedent. So we're always striving to make sure we, the county, don't subsidize work performed elsewhere.
Perfect. Thank you so much for that detailed explanation. Appreciate it. Yield the floor.
All right, any further questions? All those in favor, please signify by saying aye.
Aye.
Are there any opposed? Item carries. Next item, please.
Referral 23-0384, acceptance of a grant from the New York State Governor's Traffic Safety Committee for the comprehensive toxicology testing in driving under the influence and driving under the influence of drugs program, Office of the Medical Examiner.
Moved by legislator Dondorfer, seconded by legislator Morris. Are there any questions? Legislator Dondorfer, please.
Through the chair to the administration, any idea why the funding decreased from last year?
Chair, did you ask why the decrease from last year?
Yes.
So the reason is that we base this grants budget on the number of cases that we get. And we always try to have as accurate a number as possible relative to the most recent data that we get right before the proposal goes in. So it was a little bit less when this proposal went in relative to the same time last year. And that's really all it is, the chair.
Thank you.
Any further questions? All those in favor, please signify by saying aye. Aye. Are there any opposed? Item carries. Next item, please.
Referral 23-0385, authorize a contract with Nurse Family Partnership for support of the Nurse Family Partnership Program.
Moved by legislator Morris, seconded by legislator Brew. Are there any questions? All those in favor, please signify by saying aye. Aye. Are there any opposed? Item carries. Next item, please.
Referral 23-0386, authorized contracts with Karen Rosenblum, Paul D. Stefano, William Hawkins, Pamela Grant, and any other qualified individual to provide municipal representative services for the preschool special education program.
Moved by legislator Brew, seconded by legislator Smith. Are there any questions? Legislator Brew.
Thank you. Through the chair of the administration, how much money will each representative receive?
Through the chair, Roxana Insco. Each representative takes a portion of the meetings. Some of them attend more meetings than others. So I think two of them tend to attend more meetings than the other two. These are all for mostly retired individuals working part-time. So, it's broken up between, the total budget is broken up between the four of them.
Chair of the Administration, note that there are two non-Monroe County residents.
Through the chair, as I stated, these are, tend to be positions filled by retired individuals who work part-time. So in order to meet all of the meetings that we need to, we hire all four of them, and they do their pieces as they can. And, some of them live a little further out towards some of our further out school districts.
Thank you. I yield the floor.
Legislator Smith.
Administration, can you give us a brief responsibility of what they exactly do?
Through the chair, the municipal reps act as a member of the Committee on Preschool Special Education team that meets for each child to develop their IEP, and they represent the county.
Thank you.
Any further questions? All those in favor, please signify by saying aye.
Aye.
Are there any opposed? Item carries. Next item, please.
Referral 23-0387, acceptance of funding from the New York State Office of Mental Health and amend Resolution 393 of 2022 as amended by Resolutions 142, 225, and 298 of 2023, and the resolution adopted pursuant to referral 23-0314, authorizing contracts for the provision of mental health, developmental disabilities, and alcoholism and substance abuse services in 2023 for the Monroe County Office of Mental Health.
Moved by Legislator Smith, seconded by Legislator Dondorfer. Legislator Smith.
Through you to the administration, why has this resolution been amended so frequently?
Through the president, hi. Sorry, thank you, through the chair. Yes, because we get frequent state aid dollars throughout the year, which requires us to get the approval from you all to accept the dollars, which I am appreciative and the community is too. So thank you.
Thank you. I yield the floor.
Further questions? All those in favor, please signify by saying aye.
Aye.
Are there any opposed? Item carries. Next item, please.
Referral 23-0388, authorized contracts for the provision of mental health, developmental disability, and alcoholism and substance abuse services in 2024 for the Monroe County Office of Mental Health.
Moved by Legislator Dondorfer, seconded by Legislator Morris. Are there any questions? Legislator Dondorfer.
Thank you. Through the chair to the administration, if the legislature passes this now, can changes still be made in the 2024 budget that is now being considered?
So, Mr. Chair, just to clarify, your question is, if you approve this and then we change the budget, is there a problem? There may be, so we structure the agenda for December so that referrals that are dependent upon this legislature passing a budget are voted on after, just in case something comes up.
Got it. Thank you. I yield the floor.
Any further questions? All those in favor, please signify by saying aye.
Aye.
Are there any opposed? Item carries. Next item, please.
Referral 23-0389, authorize intermunicipal agreements with municipalities for Rochester Monroe County Youth Bureau programs in 2024.
Moved by Legislator Morris, seconded by Legislator Brew. Legislator Morris.
Thank you. Through you, Mr. Chairman, to the administration. Why are there a few towns that are not getting IMAs? Is it because they don't have programs in those municipalities or some other reason?
Through the chair, some of the municipalities with the census being so small, the funding doesn't come through the state. So as we explained earlier, with the pass-through through that state funding, they give it to the specific towns and villages as part of their census tract, and the funding is allocated as such.
Thank you. I yield the floor.
Any further questions? All those in favor, please signify by saying aye.
Aye.
Are there any opposed? Item carries. Next item, please.
Referral 23-0390, authorized contracts with not-for-profit agencies for Rochester, Monroe County Youth Bureau programs in 2024.
Moved by legislator Brew, seconded by legislator Smith. Are there any questions? All those in favor, please signify by saying aye. Are there any opposed? Item carries. Next item, please.
Referral 23-0391, authorization to contract for Monroe County Office for the Aging programs in 2024, 2025.
Moved by legislator Smith, seconded by legislator Dondorfer. Are there any questions? All those in favor, please signify by saying aye. Aye. Are there any opposed? Item carries. Next item, please.
Referral 23-0408, authorized professional services contracts for the Monroe County Office of Mental Health Socio-Legal Center.
Moved by legislator Dondorfer, seconded by legislator Morris. Legislator Dondorfer.
Through the chair to the administration, how will the money be split between the doctors and RIT?
Through the chair, if you allow, we will provide that information.
Thank you. Can you, through the chair to the administration, can you also provide an example of the services provided by the Socio Legal Center?
Absolutely.
Thank you.
Any further questions? Hearing none, all those in favor, please signify by saying aye. Aye. Are there any opposed? Item carries. Next item, please.
Referral 23-0410, acceptance of a grant from Health Research, Inc., New York State Department of Health for the New York State Public Health Corps Fellowship Program.
Moved by legislator Morris, seconded by legislator Brew. Legislator Morris, please.
Administration, as this is the first year that the county has received this grant, where did the funding for this program come from previously, or is it a new program this year?
Through the chair, this is a new program coming through New York State Department of Health. This is the first time that we have applied for such program.
Thank you. Thank you.
Any further questions? Being none, all those in favor, please signify by saying aye. Are there any opposed? Item carries. Next item, please.
Referral 23-0413, authorized contracts with Rochester Industries Placement, DBA Authentica, and WorkFit Medical for medical occupational examinations and consultations for Monroe County employees and the Monroe County Hazmat Team.
Moved by legislator Brew, seconded by legislator Dondorfer. Are there any questions? Legislator Brew.
Chair of the administration, how will it be determined which vendor is used? Are there different disciplines fitting the expertise of the individual contractors?
Through the chair, each company provides different services. There wasn't one that would do everything that we needed, so we have to use both.
I suspect. Thank you.
Are there any further questions? Seeing none, all those in favor, please signify by saying aye. Aye. Are there any opposed? Item carries. Are there any other matters to come before this committee? There being no other matters, the November 28, 2023 meeting of the Human Services Committee stands adjourned. The next meeting of the Human Services Committee will be announced. Thank you.